Since the COVID-19 vaccine became available, there have been a lot of questions. We've heard stories from people on both sides who've been trying to make a decision for themselves whether or not to get it. Now, healthcare workers are trying to give folks faith that the vaccine is safe. Our Bryant Reed joins us live now on the south side. And Bryant, we're still in phase 1A, but there is a specific target audience these health leaders are focusing on, right?
Yeah, and that target audience is underserved and minority communities. There's been history that points towards healthcare mistrust in those same communities. So UPMC figured the best way to bridge that gap would be to give the COVID-19 vaccine to healthcare workers who live and work in those same areas. By now, we've seen the process. Sleeves are rolled up, the COVID-19 vaccine is administered, and you go about your day. But the shots here have a little more meaning than keeping these community healthcare workers safe. It's encouragement for others.
It elevates this idea that health is not just within the healthcare system. Health happens in communities, and community health workers are essential for healthcare infrastructure.
Rahavan is a health equity researcher and part of a community vaccine collaborative who works with community health leaders to address the disproportionate impact of COVID-19 in minority communities. She works with people like Richard Garland, who got the vaccine today, and is part of the COVID-19 Black Equity Coalition.
I always tell people I'm gonna keep it 100, so if I'm feeling bad, I would tell them I'm feeling bad, but this was like taking a flu shot for me.
It's a show and tell of how the vaccine works and trying to debunk any theories or misinformation. And the best way to do that is through education, to let them know although it affects everybody differently, it's safe.
The more I look at the numbers of the increase in people that are contacting COVID-19, the more I'm trying to get people to take this shot.
The community health workers who are going to be vaccinated today are trusted members of their communities. And so then they can sort of share what their story was like getting vaccinated and share that with the folks in their communities who trust them very much.
Dr. Alfred Littrelli, the administering director here at this location, says they want to keep making the push to educate underserved communities so they can make a better, more informed decision when the COVID-19 vaccine becomes available to them. And he says they're off to a good start. The community acceptance rate is somewhere in the mid-80s. Reporting on the south side tonight, Bryant Reed, KDKA News.